Actually, good news this morning, which I wasn't supposed to announce till later at a press conference, but I'll give you guys a little preview. We've actually just confirmed agreements in principle with the 4 Atlantic provinces and Ontario who've said, yes, we're in for these healthcare deals. Let's start negotiating the details on how many family doctors we want to add, what we're going to be investing in mental health, how we're going to move forward to get the best possible outcomes for Canadians over the coming years. So that's fresh off the press this morning that a whole bunch of provinces are raring to go. There's lots more to do. When we made the healthcare announcement and we had the meeting with the First Ministers a few weeks ago, I said we were going to get moving forward on negotiations within weeks, not months. And that's exactly what we're doing. I can also highlight that there's many other jurisdictions, provinces across the country that are interested in starting the important work of delivering better results for Canadians. But I do want to take a moment to thank the premiers of Nova Scotia, New Brunswick, Prince Edward Island, Newfoundland and Labrador, and Ontario for being leaders in stepping up and starting to really improve healthcare systems for their citizens at a time of crisis.
What will happen if there is inconsistency across the country in terms of healthcare outcomes? How will the federal government, will you intervene to ensure consistency and equality?
I think it's fair to assume that if there are inconsistencies across the country in the coming years in outcomes, if some provinces have vastly better or vastly worse outcomes than others, given the transparency, the data sharing, the information that is integral to everything we move forward with on data, journalists will be doing their jobs and asking that of the deliverers of healthcare, of the provincial governments that deliver healthcare. Unions will be asking their questions about how there are worse outcomes for their members who are working to serve partners. And Canadians, residents of those provinces, will be asking very legitimate questions as to why they are getting worse healthcare outcomes than their fellow Canadians who are living across a border or across a river or across the country. Those who are responsible for delivering healthcare are held to account for that delivery.